On this episode of IT Unplugged, we look at the evolving technology needs in the healthcare field.
At M2 Technology, we're on a mission to make IT accessible to everyone. Join us on our journey to demystify the ever-evolving world of business technology. Are you ready to get unplugged?
Welcome back to IT Unplugged. I'm Brandon.
And I'm Dr. Lynn Wagner.
Dr. Wagner, I'm so excited that you're here to talk with us today.
I'm excited too.
Yeah. Would you mind just explaining a little bit about integrative medicine and who you are a little bit so our viewers can kind of understand?
Yes, absolutely. I say this all the time to my patients, so it's like a canned speech. But basically, I am an integrative medicine physician. I was an ER physician for years, but I got to a point in my career and in my personal life where I was needing to reach outside of the box a little bit for certain issues or even for my patients, for my family. And I really was confused as to why we hadn't been taught these things in traditional medical training or in my residency. And so I went on to pursue a fellowship in integrative medicine, which is basically a specialty that allows practitioners like doctors, PAs, nurse practitioners to not only use what they learned from the traditional medical system, but use things that are considered alternative or complementary. I just think of it as things that are outside of the box. So it trained me how to explore that world.
Sure.
And bring in things from that world that I thought were reasonable, safe, and could get my patients to their goals faster. So basically, I use a bit of both worlds to now treat my patients, and that's why it's integrative.
Yeah, okay. That's very interesting. So I'm just kind of curious, was there a moment, like when you were starting to study integrative medicine and stuff, going from ER to integrative, was there like a moment that it clicked and you're like, oh, this is what I want to do?
There wasn't one moment. I mean, I really believe in synchronicity, and I just had all these little things happening in my life that just like paved the path. It was like an aha moment one after the other.
Yeah.
Just super easy, even to the point where when I decided to pursue the training, I was at that point in time a partner at Baycare Clinic.
Sure.
And they granted me a fellowship to pay for the entire, or a scholarship to pay for the entire fellowship. So I mean, it was just like, it was so easy.
Yeah.
It was just like, this is what you have to do.
So when you say integrative medicine, and I know you kind of gave a little bit of an example there, I think people could go into like a million different things. About
right.
Yeah, it's
right.
like, okay, are we talking crystals and like random things that? Yeah,
yes.
like what is it that like mostly that, I don't want to say mostly because I know you do a lot.
Right.
But like, what does it kind of revolve around?
So, I mean, what we mostly do in the clinic is we provide patients with a holistic treatment plan.
Okay.
So instead of, when you go to your regular doctor, you go for a problem and you get something for that one problem. And we approach patients as a whole system, as a whole person, mind, body, and spirit. So we're thinking about their body, we're thinking about their mind, we're thinking about their spirit. And then we're crafting a plan that's meant to kind of bring all of their systems into balance.
Sure.
It's not just like, oh, I'm a cardiologist, I'm going to take care of your heart. But if you have a gut problem, you have to go see your GI doctor. And those doctors are great, and we refer to them all the time. But we're trying to look at the person as a whole system.
Yeah. Well, no, I love that. I'd love that as a patient.
Yeah,
what I mean?
It's amazing.
Yeah.
It's so cool.
Because it's like sometimes you're just fixing one thing.
And it's never one thing. I mean,
Yes.
our systems in our body aren't like these silos.
Sure.
We're a whole person. We're an organism.
Yeah. I mean, I know very, very little, right, in this section, but just, family health issues or different things like that. And then you start looking and you're like, oh, food can make a big difference.
Yes.
Or this kind of exercise. and you're like, oh, so it's not just like this one pill,
No.
like maybe I could take.
I mean, when
I
I did medical training, we had maybe 2 to 4 hours of nutrition education.
That's it?
Yes.
Goodness.
I don't even know if I had any. I mean, all of my nutrition education came in during my integrative medicine fellowship and then in self-study.
Okay. So can you help me, I know this is kind of off script a little bit, but can you help me understand, like, so you have that traditional medical school, but then like the integrative medicine, is it just, it seems like you have to almost like seek it out and go find it.
Oh, you totally do.
So what does that look like?
There's no direct path, because basically once you're a practicing practitioner, then you have to choose if you want to do your training through the integrative medicine fellowship. You can do functional medicine training. There's different schools, but it's not like a fellowship or a residency that's offered in traditional medical training. Okay. So I get people all the time who are in high school, college, med school, and they're like, how do I do what you do? And I'm like, I don't know. There is no direct path.
Yeah.
It's a self-forged path, which is, it's somewhat unfortunate because I feel like some providers seek it out and do it, but they don't have the basis. So there are a lot of practitioners out there who are doing functional medicine or holistic practices, but they don't have like the baseline of medical training.
Okay.
So it dirties the water a little bit.
Yeah, yeah.
So you get people who are out there, I think, that are, prescribing medical treatments, but they don't have that basic medical knowledge underneath it to be safe with it.
Yeah, I think it brings in that trust factor then,
Right.
right? So
yeah.
it's like,
So I love that I have an MD.
Yes.
Because I'm like, I did the medical training, so
Yeah.
I can keep you safe.
Yes.
And then I can also look outside of the box a little bit and go in the gray area.
Yeah, and if you look on your website, you guys have, so many different things when
We
you
do.
say outside of the box.
Yeah.
I mean, I absolutely love it. And I look and I'm like, I want to try all these.
Right.
I don't know.
Well, that's why we have them, because I'm like, I want to try all these things.
Yeah,
so why don't I just bring it into my business?
Yeah. So what does that look like when you bring something new into your business when it comes to a treatment or something like that? Like, how do you kind of go, all right, this is something that we're going to implement?
It's usually something where I have to know that it's going to give a good outcome.
Mm-hmm.
You know what I mean?
Yeah.
So if it's like IV therapy, for example, I know
Yeah.
that there are instances where people need to help with their detox pathways, or they need to help their immune system, or they just need better, they don't absorb their nutrients very well, so it's going to be better to go in through an IV. So I know that it has to benefit my patient, and it just has to make sense. I explore things all the time.
Yeah.
I've explored putting a whole biohacking section in my clinic. And,
Sure.
But, it's just one of those things where if there's other people in the community who are already doing it and I can refer my patients to them, I don't necessarily want to bring it into my business. But
Okay.
if no one else is doing it in town and my patients can't find it somewhere and I can't find it somewhere, then we'll bring it in.
Okay. Yeah. You say you test it and stuff like that. Do you get to test some of this stuff?
Oh,
or
yeah,
is
I
it
test everything.
Okay.
Yeah. Yes.
No, okay.
It's very selfish.
Yeah. Well, no, I mean, it's fun. I mean, you're not going to be like, hey, come on over here and have someone else do it,
No,
right? Yeah.
no. And I mean,
Yeah.
I'm 48 years old, so for me, a lot of it is anti-aging, longevity, and I really like to feel like I like to feel good. So because I love to be creative and get in that flow state, and
Yeah.
so everything I do, I'm like, what can I do that my body is going to be in just perfect shape so that my brain is firing, all
Yeah.
the cylinders are firing.
Yeah. We talk a lot about trust because IT and technology, like you want a partner that you can trust.
Right.
So, I'm just kind of curious, like people that are like my generation, maybe younger, kind of like studies show that they don't have that much trust for, just a lot of establishments. Kind of you think of medical as one of those like large establishments.
Yes.
So, and you're like, it's assembly line a little bit. So do you I'm kind of curious who your customers are, like, and who you're catering to, or who are the people that are coming in, and what are their attitudes kind of towards it, because it feels really refreshing.
Yeah, it's nice because there's a huge mistrust with the medical system right now, just huge. And a lot of it is because what the medical system to do itself. That it's been just really messy, and people are having poor outcomes. They're having poor communication with their providers. The providers only have so many minutes to spend with their patients. And so they have this huge distrust in the medical system. And typically people are self-referred, or they're referred by a loved one or a good friend.
Sure.
We do have some traditional doctors now referring to us, which is really, really nice.
Yeah.
I love it. That took a long time though, and that
Yeah.
took like 10 years.
Yeah. How do you build that trust? Just curious.
I think they see their patient outcomes. So
Yeah.
they see their patient and they've been on the same path for a while, and then they come to see us and they go back to their next appointment with their doctor. They're like, oh my gosh, you're so much brighter.
Yes.
You're thinner, you're more muscular, you're happier, all the things. And then they have trust with us that we can help be a consult for them.
Yeah,
We're
yeah.
not trying to take over their primary care because they're needed, but we're a nice adjunct.
Yeah. Yeah, we talk about that all the time, like stacking wins, and then that builds trust
Yes.
over time.
Yeah.
So really, really neat. And I'm sure some people come in and try one thing, and they're like, oh, this is cool. And then they're like, okay, if this works,
Right,
I'm going to go
right.
to the next thing,
Right.
and the next thing, and the next. So just kind of curious, how does technology play a part when it comes to practicing medicine? Like, how has it kind of changed your practice or integrative health?
I think that's a big question.
I know.
I mean, it's fully integrated into practicing medicine. And I'm excited, from your medical record to your phone system to, I do a lot with social media and video
Sure.
production. And you guys have helped me with all that, obviously. But it's fully integrated. And I'm actually really excited with what's to come because, for example, like right now when I see a patient, I'm sitting there typing and looking at my computer the whole time. And I know that shortly I'll probably just be able to talk and
Yeah.
the computer will just generate a chart for me.
Sure.
So I'm really excited for what's to come.
Yeah, I think that efficiency is nice. And like anytime you can probably focus more on customer care
Yes.
and not the admin
Yes.
stuff. I mean, my sister's a social worker, and notes take just as long
terrible.
as meeting with someone,
Yes,
right? So
yes.
it's like, okay, I'll do notes for, and every hour I see someone, I'm doing 45 minutes of notes. And it's like, wow, if you could just take that and remove it,
Right.
you know what I mean? But there's privacy concerns and different things like that.
Right.
So as soon as we get that kind of sorted out, it seems like more time focused on
Yeah,
customers.
I mean, I don't want to say you can't practice medicine without technology, but technology is just so critical for practicing good medicine now.
Yeah.
Especially with all the information we have available to us. You can pull stuff rather than spending hours researching it. You can get that information really fast now.
Yeah. So I saw that you're licensed in multiple different states. So do you guys do telehealth, or do you leverage technology through that? Like,
We
how
do.
How does that kind of work, and how has that helped expand your practice?
We do. The only issue with telehealth is there's certain FDA rules about prescribing controlled substances, or you have to see the patient in person at least once a year now. So during COVID, it was really lax. So I was
Okay.
able to see patients anywhere in the country because they abolished those rules because of the stay-home
Sure.
rules. But now it's getting tighter again. So the out-of-state practice isn't as big of a practice anymore.
Okay.
I'm really bummed about it.
Yeah.
But I mean, technology is huge for it because I'm seeing the patient virtually. And patient care, it's really important to see them and hear them. I would even say smell them. I know it sounds really weird, but like after working in the ER for so many years, like smell is a huge part of a physical exam.
You're making me self-conscious right now.
No.
Just a little. No, I'm
but
just
like,
kidding.
I mean, you can there's like the whole vibe, and so the when you're doing things remote or with technology, the technology has to be good.
Yeah.
It has to be crisp. It has to be the running smoothly. That you're not like having delays in the Wi-Fi and the
Yeah, absolutely. I feel like there's an opportunity that might be missed in some like other places where people are interested in integrative medicine too, and they just maybe super rural or
Right,
something
for
like
sure.
that, and they're like, oh, geez, well, I'm not in a city and I
Yep.
can't get this stuff.
No, and even to my in-state patients, a lot of them choose to do telehealth.
Oh, really?
Because maybe they're an hour and a half drive away, or they have COVID. I've had that happen before,
Sure.
or they just got out of bed and didn't feel like driving in. So people will switch to telehealth all the time.
Yeah. Okay. Yeah, that's really interesting. We were in the hospital recently for a family thing, and they brought in. It was just like. It looked like out of a movie, right? They just bring in like this robot thing,
Right.
and there's like a screen on the top, and
the
nobody
doctor
says
was on the
anything.
screen?
Yeah, not yet though. They're just like, so the doctor will see you soon, and then they like walked out. We're like, what?
And the doctor came on the
Yeah,
screen?
the doctor came on the screen, and they were in California. And they were a
Right.
specialist for something. So
Right.
it's like, but that's great though.
That's
because,
incredible.
Yeah, if you don't have that person in house, it's like, well, why wouldn't you want the best person
Right.
To look at this? But there is that one thing where like, I wish you could reach out.
I know,
I was waiting
shake
for
my
the
hand.
arms to like move or
I know,
something
I
like that. But still,
That's funny.
Talking about technology, what do you think is like one of the coolest pieces of technology or treatments that you have in your facility?
Oh, that's tough. I don't feel like we're cutting edge with technology.
No, I mean
Not because of what you guys have done for us, but like
Yeah.
you go to a major medical center and they have the funds to do all
Sure.
the coolest things.
Yeah.
The best X-ray equipment, the best tech, and we're a small
Yeah,
business.
sure.
So that's a hard question.
Okay, no, yeah, I just look on and I think like as a outside consumer, like when somebody takes something and like like it looks like a laser treatment, something like for
Right.
me that's like advanced technology.
Oh no,
So
and we
when
have
I'm-
really cool gadgets.
Yeah, that's what-
we
that's
have
what
a
I'm
beautiful
kinda getting
laser.
at.
We have beautiful machines that do these amazing facials. But a lot of my integrative care doesn't really need high tech stuff.
Yeah, I got you. Okay,
It's not that high tech.
yeah. So what's kind of the vibe when you walk into Wagner Integrative Health? Like, how is it different, and what's the day-to-day look like for some people that are
Well,
there?
I mean, that's a great question because I shared with you earlier that I went to my doctor's appointment this morning, and walking into the hospital, and the vibe is, I'm very much a vibe person, and I can feel it.
Yeah.
I can feel where the vibe is, and gas stations, Walmart, hospitals, they all have the same vibe.
You're lumping them in together.
And I was like,
Even
this
Quick
is
Trip?
heavy.
You're putting Quick Trip in
No,
there?
I like
No,
Quick. No,
okay,
not
okay.
Quick Trip.
Okay.
Nope. Quick Trip has a good vibe.
Yes. Okay.
But then, I feel like when you walk into our office, our business, the vibe is high. People are happy.
Mm-hmm.
There's laughing. It's very calm and serene, but it's not a spa, so it's not
Sure.
it's not trying to be this like oasis like a spa. So it's still a medical office.
Mm-hmm.
So it feels very professional, but I think it's very relaxing and upbeat
Okay.
and high vibe.
Yeah. What do you contribute that to?
The people for sure.
Yeah.
So I mean, the people are the backbone. So you have to have good people, and you have to treat them well, and they have to be happy. But I also think the decor is just really simple.
Yeah.
So I spent a lot of time making sure that the colors were right and the furniture was right, and the art on the walls
Yeah.
is all from artists I know.
Sure.
So just
Yeah.
all of it, all the above.
That makes a big difference.
And the smells are huge.
Smells. Okay. We're good.
So if I smell
mean
if I smell a stinky garbage can, I'm like,
we're getting
I'm putting it in the dumpster. Yeah.
Yeah,
So like
yeah.
the smell is always just really nice.
There's like that smell of the medical room with the
Right.
the
astringents,
cover.
right.
Yeah, and you're just like, what? And it always, I'm a little logistically challenged, so I go back to my primary doctor all the time. I love him, he's great. But I swear it's in a different room, and there's the same picture of his family in every single room, and I'm like, and there's one picture on the wall.
Right.
And I'm just like, this is so weird. Are they
Right.
moving this picture
Right.
like every single time that I
Yes,
come in?
I know. Or when you go to some places and it's like this like canned art that they put up and
Yes.
it's faded because the sun's been shining on it.
Oh, yeah.
It's
Yeah.
pretty funny.
So I'm just kind of curious, is there any misconceptions about integrative health that
Yes.
are kind of out there?
Yes,
Or
I
ones
mean-
that maybe even strike you and you're like, whoa, I didn't even know that was like a thought out
Yes.
there.
So I had a patient yesterday who had taken her daughter to us, and we had given the daughter a diagnosis and put her on some medication. Very legit diagnosis, very traditional diagnosis.
Sure.
And she went to her family practice doctor, and she said, here's what they put me on, here are the labs to prove it. And the doctor just shamed her and said, I don't agree with anything they're doing,
Really?
on and on and on. And the
Yeah.
patient, who's been one of our patients for a long time, basically stood up to the doctor and said, this is so unprofessional of you. If you don't agree with her plan of care, you should contact Dr. Wagner, and we will never come see you again. So that's an extreme. So there
Yeah.
are still providers in the community who think that we're doing snake oil medicine.
Sure.
And I think it's people who just have their blindfolds on, and they're just doing what they were trained. They're very like
Yeah.
rote, so they do what they were trained in med school, and they're not willing to look outside of the box at all. And the fact is that new technologies in medicine take 10 to 12 years before they come mainstream.
Okay. Yeah.
So why would we wait 10 to 12 years before we actually use them when they could benefit our patients?
Sure.
So that's an extreme. But then I have a lot of people out there who are fully referring to us and like, I love what you're doing for my patient. So it's like all over the board.
Yeah. Is it a lot of red tape? Like why that 10 to 20 years, like new technology?
Yeah, I mean, it's like FDA approval and
Yeah.
research needs to be done, and the studies take a long time to
Sure.
perform.
That's so scary to me though, because like if not the needing approval kind of thing, but like a doctor that's maybe been doing it a certain way, because I just think of medicine. I mean, what they did 50 years ago.
What we did
I
10
don't
years
want-
ago.
Yeah, I don't
What I
want
did
them-
2 years ago.
Yeah, it's like, I don't want them doing that
It's-
to me now.
no.
They found out it doesn't work or it's
Right.
damaging or something like that.
And I mean, we're in this age of just information is just pounding us from everywhere.
Mm-hmm.
And why wouldn't we take that information and use it for the benefit of our patients?
Yeah, absolutely. So you kind of like mentioned a little bit of a success story, but I'm curious, like, what's one of your favorite success stories? I know you can't share,
No, I have one. I definitely
Okay.
have one.
Yeah.
I have one because a patient came to me and she had been, seeing her regular doctor every year. And every year she went, they're like, oh, you've gained a little bit of weight. Your blood sugar's getting higher. Here's another drug.
Yep.
And then yada, yada. So she finally came to see us, which was a big move for her because she had to pay cash to see us. So
Yeah.
that's a huge barrier for people. And I understand that. And we diagnosed her with what she had, different things, and treated her and also taught her how to eat better and also talked about exercise and the importance of sleep and stress reduction. And, within a year and a half, she went from someone who could barely walk down her stairs because she had so much pain and inflammation. She was isolating herself. She was depressed, to someone who was going to the beach wearing a swimsuit.
Yeah.
I see her out in the community hanging out with people, having fun, no pain. Her weight is down. One of her diagnoses is gone. The diabetes actually went away because her blood sugar got under control. So it was incredible.
That's so cool. That's got to be so
incredible.
rewarding.
It was so rewarding.
to kind of feel that
Yeah.
and know that you're making that impact.
Yeah.
So M2 technology. We're obviously talking about some tech stuff, but I want to know like a
And
really.
you might be talking to one of the least tech
Oh,
savvy
that's
people
okay.
you know.
That's okay.
As Mike knows.
This next question.
I'm like, which button do I press?
this next.
Fix my laptop.
And that's what we're here for, right? Like that's fine.
Set up my podcast.
This is we can do that too. But this is more a low tech question. So there's like a lot of high tech stuff that you can do. But what's like a low tech hack or like a no tech hack that you just absolutely are like, I can't live without this?
Well, I can't live without my Mac.
Okay.
Like that thing's like tied to me like in a pen, like a child.
Okay. Yeah.
So I can't live without my MacBook.
Okay.
I also would say that's a hard one too. My iPhone.
Yeah.
Is that well? So I mean, so basically pulling up like Hippocrates, which is where we look at drugs and we can do
Sure.
drug interaction checkers.
Well, that's a good segue, though. Like, okay, so let's go this direction. What is some of the things that, like, you're running a business, you're obviously very busy, it's growing. What are some of the ways that tech has helped you manage running your business, and then also, like, like kind of staying insane as a business owner as it grows?
Yeah. No, I mean, tech is part of everything I do.
Yeah.
I mean, even I use the podcast as an example. I know it's not clinical care, but it's my love. It's what I love doing the most. And we use a software or a website. I don't know if you call it a software or website, but basically it records the podcast, but then it'll create the audio version, the video version.
Yeah.
It'll do short clips.
Oh, nice.
It'll do transcripts. It'll do the
Captions?
the captions,
Yeah,
right?
yeah.
All the stuff. And so it's so much less work. I think about 10 years ago where you literally have to like listen to the whole video and then
Oh, yeah.
cut it and then add the captions. Like it's just like
Yeah.
blows it out of the
And I still
water.
write it wrong every time. And
Or
then, like,
even-
it's WAG, not EG.
Right.
and
Oh
you gotta
yeah.
go through every
Even
single
when
one.
I'm typing and all the auto corrections. I mean, something simple as that.
Yeah.
I mean, I make typos all the time, and then they just automatically get fixed. I use ChatGPT all the time.
Do you?
All the time.
What do you use it for? I mean,
I use it in the middle of patient
of
patient appointments.
Oh, really?
Yes, because obviously I'm going to vet the information and make sure it's good.
Yeah.
But it's just a super easy way to pull from all the information that's on the internet and give me an answer, and I'll be like, okay, that makes sense. Now I'm going to go research it and make sure that's right.
Yes.
I use it all the time.
Yeah, like as a
and I tell my
supplemental
patients,
additional
I'm
thing.
like, I'm going to look this up right now. Because they
I-
ask me all these random questions. I'm like, I can't know everything.
Well, yeah, exactly. That's a great point. And, who knows what you get from an algorithm that's owned by someone else. You know what I
Right,
mean?
right.
They're all algorithms that
Yeah.
are owned by someone, right?
Yeah, and then you can
But-
go on PubMed and you can look for actual research articles to prove that what you found on ChatGPT is correct, and it usually is.
Yeah, awesome. No, that's great. I think just that willingness to try new things and,
Yeah.
kind of continue to expand is what leads to innovation and then leads to long-term success.
And I'm really excited with AI. I think that, and one example, and this is probably in the weeds a little bit, but we do a lot of genetic testing, especially on methylation, and it's really, really complicated. And there's all these different pathways and all these different genes, and whether you have your SNPs in them or not depends on which vitamins you should take. And I know that eventually you literally be able to test your genes, and then AI will pull together which specific supplements you need for which pathway,
Oh my
because you
gosh.
have deficient or
Yeah.
genes that aren't working as well as they should.
I can't wait for something
It's gonna be
like
really
that.
cool, yeah.
Yeah. I mean, we were just, even off record on the podcast, like, someone just tell me what to do with my
Right,
health.
yeah,
Like,
no,
that'd be
that one,
amazing.
I kind
Yeah.
of want to invent it actually, because I'm sick of having to think through it every time. I'm like, this does not have to be so hard.
Yeah, yeah,
I
absolutely.
don't need to use my brain for this.
Yeah. Well, as we kind of wrap up here, Dr. Wagner, what is something that you might like kind of tell people that are out there that maybe a little bit frustrated with traditional medicine and they're just looking for other solutions? What would you kind of say?
I would say I think the people that do best are the ones who spend time researching it first. So what is integrative medicine? What is functional medicine? Study nutrition, get a little bit of information on it so you come in prepared and start doing some of the things. A lot of the stuff you can do on your own.
Yeah.
And then if you are struggling with a problem, or if you just want to be the healthiest person you can be, the strongest, clearest, productive, successful person, you don't have to have a problem to see an integrative medicine provider. Some of my favorite patients are just those like biohackers who are
Yeah.
just like, I want to be amazing.
Yeah.
I'm like, great, let's check all your labs, let's make sure your hormones are optimized. Let me tell you all that biohacking stuff you should do. And so you can be any kind. And also I would say, so don't wait till something's broken before you fix it.
Yeah,
I'm
that's great
very
advice.
much about preventative medicine. And also I think people are really scared about the cost of it.
Yeah.
But it blows away. Like the cost of seeing someone like us takes away years of medical expenses.
Yeah.
And drugs and procedures and doctor's visits. Like you literally save money doing it.
Yeah.
Because you're keeping yourself out of the traditional medical
Well,
system.
I mean, sounds like a great return on investment.
A
I
huge return on investment.
Get to be healthier, get to
Yeah,
live longer,
right.
you know what I mean? Get
Yes,
to do all these
yes.
different things and save money too.
Yes.
So awesome. Well, this has been a great conversation. I just love learning about new things, and integrative medicine seems like just such a wonderful thing that can change so many people's lives. We just want to highlight it, and
And I do want to add, because we didn't talk about tech that much, because I'm
Oh,
terrible at
that's
tech,
okay.
but I would say the reason I can be terrible at tech is because you guys just take care of it for me.
Yeah.
So
appreciate the shout
yeah,
out.
so that's a shout out. I'm totally serious. Like, I don't have to think about it. I really don't want to think about it.
Yeah.
Like, I want to use tech and I want to use it the best that I can, but I don't want to have to think about it because there's other things I want to think about.
Yeah,
So
100%.
pairing, and that's what I love about you guys is, we chose you. It was super random. The way Cassie found Mike was super random, and it has been amazing because I'm not working with this big box company that you have to wait for. We reach out to you guys and you guys take care of things right away, and I never have to worry about it.
Yeah, we appreciate you saying that. So, well, awesome. Thanks so much, Dr. Wagner. And thank you for watching IT Unplugged. Stay tuned for more episodes. Hit the subscribe button, and can't wait to talk to you again. Thanks.